Hello everyone. Today I am going to tell you about mitral regurgitation. We are discussing the cardiology series and here I make videos pertaining to the MLE exams. Without further delay, let's get started. What about the mitral regurgitation? The mitral regurgitation, the most important thing you need to know is about the murmur. What is the murmur in mitral regurgitation? I am not a cardiology person, so sometimes the murmurs confuse me. I need to go through the pathophysiology and still get it wrong. So I have some clues which I think might help. So in mitral regurgitation, MR, I remember it as MRS. That's a common word, right? So therefore, the murmur which is seen in mitral regurgitation is the systolic murmur. Hi. Is the systolic murmur. So it is generally a holosystolic murmur. Fine. Now what is the reason behind mitral regurgitation? The most common reason behind mitral regurgitation is, if you see, this is the right atrium, right ventricle, and this is the mitral valve. Here the papillary muscle holds the mitral valve, right? When the papillary muscle undergoes rupture, then it cannot hold the valve properly, thereby resulting in mitral regurgitation. So papillary muscle rupture. So why should a papillary muscle rupture happen? A papillary muscle rupture can happen because of an MI. So because of a decreased blood supply to the papillary muscle following a myocardial infarction, that can result in mitral regurgitation. So the question Vignet will point towards a patient who had a recent myocardial infarction now presents with a new systolic murmur. So what is the reason? It is because of a papillary muscle rupture resulting in mitral regurgitation. The second most important reason is the rheumatic heart disease. Rheumatic heart disease, it generally happens when the body attacks its own valve. So in rheumatic heart disease, because of molecular mimicry, the body instead of attacking the organism and the M protein in the myocardial, in the valve, are almost the same. So it mistakenly attacks the valve, resulting in rheumatic heart disease. Resulting in mitral regurgitation. The patients with rheumatic heart disease will suffer with mitral regurgitation initially, but over a couple of years, that same valve will scar and it will form mitral stenosis. Mitral stenosis, I have a video for you. I will give in the playlist. Add a playlist. The third most important cause for mitral regurgitation is generalized ischemia. When there is a generalized ischemia, then the papillary muscle also undergoes. Papillary muscle is also affected because the papillary muscle also doesn't receive the blood, right? Therefore, it will result in mitral regurgitation. What is the fourth reason? The fourth reason is dilated cardiomyopathy. What happens in dilated cardiomyopathy? In dilated cardiomyopathy, because of generalized dilatation of all the four chambers, the mitral valve is also ventricle is dilated, thereby the mitral valve is also pulled apart and it results in mitral regurgitation. These are the four important reasons for mitral regurgitation. Number one being the papillary muscle rupture and the second being the rheumatic heart disease. And there is a question where they indicate that a patient with regurgitation presents with a jugular venous distension. Do they or can they present with jugular venous distension? Of course they can, because of mitral regurgitation, because of the pressure being transmitted all the way to the right side, it can result in a jugular venous distension. Fine. And there is in step 2 CKMLE exams, they might ask you whether a pre-op stress test is indicated in mitral regurgitation. If there is isolated mitral regurgitation, that is the patient does not have any other issues at all in the heart, they have only mitral regurgitation, then the preoperative stress test is not indicated. You need not have to do a preoperative stress test before surgery if the patient is suffering from only mitral regurgitation. With this, we have covered the basics which are asked in MLE exams. Thank you for listening. All the best for your exams.